right, joining us now, we welcome back Montana Senator, Mr. Steve Daines. Senator Daines, welcome back, sir. I want to ask you about health care and all the Just tell me, we're not going to have another shutdown, are we? When this CR runs out at the end of next month, tell us we're not going to have another shutdown.
Well, Larry, I hope we don't have another shutdown. It's possible if we can't get cooperation. January 30th is the key date. That's what the CR extends to. But we are working very hard right now on the Republican side and the Democrat side, to their credit, to come together to get these last appropriation bills voted on and passed. So I'm cautiously optimistic, Larry, we're going to get the work done. We'll get a lot of this finished up this week, perhaps, and then use January to finish it up. So fingers crossed, Larry, but we're in a better spot right now than we were certainly on September 30th.
You need 60 votes for these appropriation bills?
We'll need 60.
Yeah.
So it takes 60 votes. That's why, just like what happened with the Schumer shutdown, we needed 8 Democrats to join us to get the government opened up again. And as I've always said, Larry, shutdowns begin with a bang and they end with a whimper. And they put their hand on the stove, eventually say that doesn't feel very good. When you start having the flying public interfere with air traffic control and coming up with Thanksgiving holidays, the Democrats finally said, okay, enough's enough. And we had 8 Democrats quietly join us, and we got the shutdown stopped. But I was proud of the Republican team, Larry. We held firm. You shouldn't be allowed to take a government shutdown hostage in an appropriation debate. And let's just hope and pray that as we go through January, this nonsense won't happen again in Washington. We'll get this work done.
So everybody's talking about health care reform. I had Senator Blackburn on last night talk. You know, look, President has said this, I'm sure you agree. The individual should get the benefits. Health savings accounts are a very useful vehicle. I always ask, and Senator Blackburn always asks about interstate insurance. Why can't you have portability? Why can't you go across state lines for your insurance? That would add competition, bring down costs. These are sensible reforms. They've been around for a while. Democrats never seem to like them.
Larry, I'm not sure they want to solve this problem. What I hear quietly from folks across the aisle is they want to have this continue into the 26 election because they think this is a winning issue for them. Sadly, frankly, because the American people are being harmed. You look at Obamacare premiums are up half again as much as private health care insurance over the same period of time over the last decade. Anytime the government steps in and takes over something, it drives inefficiency and higher cost. It's all about providing more choice to the patient. And what Senator Blackburn suggested is an idea for sure. Think about the idea of associations. The Democrats in the Affordable Care Act do not allow us to put associations together. For example, Costco could have their own health care. With 70 million Costco members, they could put together some kind of association plan, let people have the freedom to join associations where they could drive lower costs. Another problem is these subsidies the Democrats are fighting to protect. They go directly to the insurance company versus to the consumer. That's what we propose in our plan, is send that to HSA accounts. Let the consumer, let the patient have the power of deciding what to do with the way dollars are spent. It's one of the most expensive economic transactions in your household budget. Why can't the consumer or the patient be in charge versus insurance companies and the government?
Well, right on. That's the real affordability issue, too. You are right, Senator Steve Daines. Thank you, sir. We always appreciate it when you come on.